We all know our NHS is being defunded, run down, left to wither and die prior to full Tory privatisation. It's widely accepted that this is how the Tories privatise any public service. First, they run it into the ground, then they sell off its physical assets like buildings and equipment. Next, they just sit back and watch it crumble as underfunded, and it finally breaks under the strain of excessive demand for services it's no longer able to provide. Cuts are labelled as efficiency savings, but in reality they're a further means to destroy the NHS and have the public demanding that the likes of brands like Virgin Care step in and save the day. It's against this background that I speak about the state of the NHS mental health services in the Norfolk and Suffolk Trust area. Users of these services, including the incurably mentally ill, the frequently suicidal, the clinically depressed, those who self-harm, those with dementia, those with physical illness that has led to mental impairment, are being improperly served in all respects. From experience, I know that a person who has been actively suicidal, pre-planning their method, means and opportunity, a person already known to the system, a person on medication for severe mental illness, now only gets a telephone assessment in another suicidal crisis. Think about that for a moment, if you would, if you know somebody who's mentally ill, even if you're mentally ill yourself or you have a loved one with mental illness. Just think about it. They can have the tablets all saved up. They can have what is called suicidal ideation. They can have a history of attempted suicide, actual self-harm, and the first thing they will have to do in what we call a crisis, certainly in Norfolk and Suffolk, is to wait for a call back from the mental health team. This callback, naturally, will take time. And while waiting for it, it's pretty certain that some people must take their own lives just while waiting. Now, were this same person, say, known to cardiac services at the nearest hospital, were they on the books with cardiologists and they'd had another cardiac event, they'd be whisked into A&E, and if need be, they'd be admitted, seen by the cardiology team, and not discharged until they were stabilised. Simple, isn't it? Yeah. If your heart goes wrong, you get instant treatment. But if your head is failing and causing you to harm yourself, you get a call back. Wow. That's bad, isn't it? Let's be perfectly clear. The Tories in particular are delighted when mentally ill people take their own lives. First of all, to them, that's one less mouth to feed. The Germans once saw their mentally ill as wertlos Essers, or worthless eaters. The Tory attitude towards the sick and disabled is, as you would imagine, pretty much the same. Hitler said, "Dead people do not claim against the state." In the eyes of May and her rich parasites that run UK PLC, he could not have spoken truer words. It is this attitude that is behind the Tory managed destruction of our NHS. So I urge you, if you in particular are a user of mental health services in Norfolk and Suffolk, I urge you to complain to your MP about this total lack of proper provision. After all, one day, this may well affect you and those you love if it does not already. I also urge you to complain to your local health services trust when you have been let down by lack of mental health care provision. You may also want to consider a separate complaint to the Care Quality Commission, along with billions of us already working to save our NHS nationally and locally. Stand up and say this is not good enough, and I'm not going to remain silent.